How to improve the chance of success in your very first IVF cycle? I think the most important would be to select the right doctor and to select the right fertility clinic. The expertise and the experience of your doctor and your fertility clinic makes a tremendous positive impact. To improve your chances of pregnancy in the very first attempt, try to optimize your health. Eat well, exercise well, try to be stress-free, sleep on time. The third point would be to follow your doctor's advice to the T. We try to optimize the number of eggs that are retrieved. If your doctor feels that this would not be the right month to start your IVF cycle, if as compared to your previous ultrasounds you have a lower follicular count in this cycle, maybe your doctor will advise you to skip the cycle and follow up in the next month. So this is why it is very important to find the right doctor who will give you the right advice on time and will not force you to initiate an IVF cycle when it's not actually a good time to start your cycle. The other ways to improve your chances of pregnancy in the very first attempt probably would be, after egg retrieval, ask your doctor what methods can be carried out to try to improve the chances of finding better sperm. There are some filtration techniques which we can use in the laboratory. These are not required for all, but may be required in some scenarios. Another way to optimize your chance of success would be to try to do long culture of the embryos in the IVF laboratory. Embryos which grow in the lab till the blastocyst stage, that is till day 5 or day 6, are competent embryos. If the embryo has grown in the lab to the blastocyst stage and we transfer such an embryo, your chance of pregnancy is slightly better as compared to when we do a day 3 embryo transfer. If your uterine lining is not looking good in the cycle that your stimulation for egg retrieval is happening, your doctor will advise you that we should freeze the embryos and not transfer the embryos because your lining is not looking good. So in that scenario, your doctor might advise you to do a hysteroscopy prior to the embryo transfer, the very first embryo transfer. So trying to ensure that you get good eggs, you get good sperm and you have a good lining can improve your chance of pregnancy in the very first attempt itself. Hence, it is important that you find the right doctor who gives you the right advice and you have a good IVF laboratory with good QA/QC in the lab and good culture conditions in the lab, and they are able to carry your embryo to culture till the blastocyst stage.